If you are over 60 and still masturbate, there is something extremely important you need to know about your prostate health. I am Dr. Naren, a urologist and men's health specialist with 7 years of clinical experience in andrology. Today, we are going to discuss a topic that most physicians will not address openly: masturbation after the age of 60. The research I am about to share may completely change the way you think about this natural activity. Harvard Medical School followed nearly 32,000 men for 18 years. What they discovered was remarkable. Men who ejaculated 21 times or more per month had a 20% lower risk of prostate cancer compared with men who ejaculated only 4 to 7 times per month. A 20% reduction in risk from something entirely natural and free. But that is only the beginning. There are important details about frequency, technique, and health benefits that every man over 60 must understand. The kinds of things that can protect your prostate, improve your sleep, reduce stress, and even support your erectile function as you age. Before we begin, please tap the like button. Leave a comment telling me where you are watching from and subscribe so you never miss essential health information designed specifically for men over 60. Now let me share what you need to know. Let me speak to you directly. Most men over 60 have questions about masturbation, but feel too embarrassed to ask their doctor. Is masturbation still normal at my age? Am I doing it too much or too little? Does it affect my health positively or negatively? Here is the reality. Research shows that 63% of men over 60 masturbate regularly. If you are doing it, you are the majority, not the exception. Studies throughout Europe show that 41 to 65% of men between 60 and 75 years old reported masturbating within the past month. What is frustrating to me as a urologist is that most men do not know that this natural activity carries significant health benefits, especially after 50 when prostate health becomes increasingly important. As we age, your prostate also enlarges. By age 60, about half of all men have an enlarged prostate. By age 85, that number reaches 90%. The risk of prostate cancer increases. In the context of all these changes, regular ejaculation, whether through sexual activity or masturbation, plays a protective role that most men are never told about. Today, I will guide you through the 7 most important things every man over 60 needs to know. This information is supported by peer-reviewed research, and it may have a meaningful impact on your long-term health. Let us begin. First, the mechanism behind effective prostate protection. This is the most important benefit, and the research supporting it is particularly strong. The Harvard study I referenced involved 31,925 men who were followed for 18 years. The findings were published in European Urology, one of the most respected journals in our field. Men who ejaculated 21 times or more per month demonstrated a 20% lower risk of prostate cancer compared with those who ejaculated only 4 to 7 times per month. Here is the biological explanation. Regular ejaculation helps flush the prostate of potentially harmful substances. Your prostate produces the fluid that mixes with sperm. When that fluid remains stagnant for long periods of time, it can become a breeding ground for inflammation, infection, and cellular changes that may become cancerous. Think of it like flushing a plumbing system. A steady flow prevents buildup and keeps everything functioning smoothly. Ejaculation reduces prostatic congestion, lowers markers of inflammation, and maintains healthy tissue turnover within the gland. I have a 62-year-old patient with a family history of prostate cancer. After discussing this research, he committed to maintaining regular sexual activity with both partnered and solo ejaculation. 5 years later, his PSA levels remain excellent, and his prostate exams have shown no concerning changes. This is not a guarantee against cancer, but it is a meaningful protective factor that you can control. If this information is new to you, tap the like button. Next, we will answer the question men struggle with most. What is the ideal frequency to achieve this protective effect? And this number is not random. Second, the optimal frequency. Most men have no reference point for what is considered healthy or normal. Research shows that ejaculating 21 times or more per month provides the strongest protective benefit. This breaks down to roughly 5 times per week. Some weeks may be more, some less, but averaging around that number appears to be optimal. This total includes all forms of ejaculation, partnered intercourse, solo masturbation, and even spontaneous nighttime emissions. Most men have no framework for understanding what a healthy or normal frequency looks like. One key point is that more is not necessarily better. The protective benefit levels off around 21 ejaculations per month. Going far beyond that does not offer additional protection and can potentially lead to other issues, which we will discuss shortly. One patient told me he felt guilty about masturbating 3 to 4 times per week despite being in a happy marriage. After reviewing the research together, he understood that this is a health practice, not a reflection of his relationship. His perspective shifted from guilt to intentional self-care. Comment below. Are you surprised by the frequency that provides optimal benefit? Third, the serious mistakes to avoid. Not all methods of masturbation are the same, especially after 60. There are mistakes that can cause real problems. First, inadequate lubrication. As you age, your skin becomes thinner and less elastic. Dry friction causes microtears in the delicate tissue, leading to irritation, scarring, and reduced sensitivity over time. Always use a quality water-based or silicone-based lubricant. This is not optional after 60. Second, excessive grip pressure. Some men experience reduced sensitivity with age and compensate by gripping more tightly. This creates a problematic cycle. More pressure causes more tissue damage, which further decreases sensitivity, which then leads to even more pressure. Use a lighter touch and focus on varied stimulation rather than forceful pressure. Third, excessive use of pornographic imagery. Occasional viewing is normal, but heavy consumption can alter the dopamine response system in your brain. Fourth, ignoring warning signs. Pain during or after masturbation, burning with urination, blood in the semen, or difficulty ejaculating are not normal. These symptoms may indicate prostatitis, urinary tract issues, or other conditions that require medical evaluation. Do not ignore them. Fifth, rushing through the process. After the age of 60, your body responds differently. Rushing can lead to incomplete ejaculation, which does not provide the full prostate clearing benefit. Take adequate time and allow for a complete and satisfying release. I treated a patient who developed chronic prostatitis from aggressive masturbation without lubrication. His symptoms included pelvic pain, urinary difficulty, and discomfort with ejaculation. After adjusting his technique and using appropriate lubricant, his symptoms resolved within 6 weeks. Technique is just as important as frequency. Fourth, the mental health benefits. The benefits extend far beyond physical health. Masturbation triggers the release of several neurochemicals. Dopamine provides pleasure and motivation. Oxytocin promotes relaxation and bonding. Serotonin improves mood. Endorphins act as natural pain relievers. Prolactin released during orgasm has documented neuroprotective properties. It helps protect brain tissue from stress-related damage. For men over 60 dealing with work pressure, health concerns, or relationship transitions, masturbation provides a natural stress relief mechanism without medications or side effects. Research shows that sexual activity, including masturbation, is associated with better sleep quality. The relaxation response after orgasm naturally prepares your body for sleep. One patient who struggled with chronic anxiety and insomnia was reluctant to use prescription sleep medication. I discussed using masturbation as part of his nighttime routine. Within 3 weeks, he reported significantly improved sleep quality and reduced anxiety levels without pharmaceutical intervention. Your mental health benefits just as much as your prostate. Stay with me because the next benefits are equally important. Fifth, supporting erectile function. This is something many men do not realize. Regular ejaculation actually helps maintain erectile function as you age. Think of it as exercise for your vascular system. Achieving regular erections promotes blood flow to penile tissue, maintains vascular elasticity, prevents tissue atrophy, and keeps the erectile mechanism responsive. Men who stop all sexual activity often experience progressive erectile dysfunction. Without steady blood flow, the tissue begins to deteriorate. It truly is a use it or lose it situation. Regular masturbation maintains the physiological pathways necessary for healthy erectile function even without a partner. Maintaining function requires consistent use. Sixth, addressing guilt and shame. This is especially important for men who grew up in religious or conservative environments. Many men experience what psychologists call masturbation guilt, a psychological conflict between behavior and internalized moral beliefs. From a purely medical perspective, I can tell you definitively that masturbation is a normal and healthy behavior with documented health benefits, especially for men over 60. There is no scientific evidence of physical or psychological harm when it is practiced reasonably and safely. If your religious or cultural beliefs create internal conflict, that is something worth exploring with a counselor or spiritual advisor. But medical science is clear. One patient told me, "I spent 50 years feeling ashamed every time I masturbated. Learning the actual science liberated me from decades of unnecessary guilt. I only wish someone had told me this 30 years ago. You are not doing anything wrong. You are maintaining your health." Seventh, when professional help is necessary. Although masturbation is healthy, there are certain situations that require professional attention. First, if it interferes with daily functioning. If you masturbate so frequently that it affects work performance, relationships, or everyday responsibilities, this indicates compulsive behavior that needs therapy. Second, if you cannot stop despite wanting to. Feeling out of control with sexual behavior is classified as compulsive sexual behavior disorder and requires specialized treatment. Third, if you experience persistent physical problems, continuous pain, bleeding, significant skin irritation, or an inability to ejaculate, these all require urological evaluation. Fourth, if it completely replaces partner intimacy. If you consistently avoid sexual connection with your partner because masturbation feels easier or more satisfying, this is a relationship issue worth addressing with a couples therapist. Regarding frequency, aim for about 20 to 21 ejaculations per month, approximately 5 times per week. This can include both partnered sex and solo activity. The total number is what matters for prostate protection. Regarding technique, always use adequate lubrication. Water-based or silicone-based products work well. Protect your tissue from friction-related injury. Regarding pacing, take enough time. Do not rush. Complete, unrushed ejaculation provides the maximum health benefit. Regarding your body, pay attention to physical feedback. Any pain, discomfort, or change in function warrants medical guidance. Regarding your mindset, release any guilt or shame. You are engaging in a scientifically validated health maintenance practice. Follow this framework and you are optimizing the benefits while avoiding the potential problems. Gentlemen, let me summarize everything. Masturbation after 50 is not something to be ashamed of, embarrassed by, or guilty about. It is a normal, healthy behavior with scientifically demonstrated health benefits. The research is clear and compelling. Regular ejaculation, around 20 to 21 times per month, significantly reduces prostate cancer risk, supports erectile function, provides mental health benefits, reduces stress, and keeps your sexual system functioning normally. Your age makes this more important, not less. Stop letting outdated shame, misinformation, or embarrassment guide your decisions. Let science and health evidence guide you instead. If this information was helpful, press the like button, comment below, and tell me what surprised you most about this research. Does it change your perspective? And subscribe to the channel for more evidence-based guidance on topics other doctors do not openly discuss. I am Dr. Naren. Your sexual health matters at every age, and you deserve honest, scientific information to make informed decisions. Take care of your prostate, take care of your overall health, and live with the confidence that you are doing what is best for your body.